have diffuse large B-cell lymphoma. So when you think about diffuse, you think about time bombs, taking away time bombs. The chemotherapy is not going to give me long-term effect. But this, they're hoping, is something that will.
This is immunotherapy, and Amy Jo Smith is among the first in the world to receive it through a clinical trial at the University of Kansas Cancer Center. Hello, I'm Jill Chadwick, and joining me is Amy Jo's doctor and medical director of the Blood and Marrow Transplant Program, Joseph McGurk. It sounds almost like science fiction, but it's actually science fact. What is immunotherapy?
So this is using the patient's own immune system to fight the cancer. The cancers are able to circumvent and sneak around the immune system and trick the immune system and keep it from killing them. And so we've tapped into strategies to turn the immune system back on against the cancer.
Well, we were there when Amy Jo was going through this infusion process. Explain what is happening.
Amy Jo is receiving an infusion of highly manipulated T cells that we had collected a little bit over a month ago and engineered in the laboratory to recognize her cancer cells. So with new technology, we're able to turn those T cells back on, put them in a syringe after multiplying them, infuse them into the patient. They sweep throughout the body, recognize the cancer cells, attach to them, and punch holes in them, killing the cancer cells.
I know that when you were talking to her, you said, here come the Pac-Man cells.
Yes.
Is that a good visual for the rest of us to understand maybe what's happening?
I think it's a great way to conceptualize the way these cells are working. They are directly homing in on the individual cancer cells, attaching to them, releasing what are called killing molecules or cytokines, and setting up a structure to put a hole in the cancer cell so it releases its contents and dies.
We want to share a little more of Amy Jo's medical journey.
I have a lot of cancer in my family.
Piggyback rides on Daddy.
Amy Jo is the mother of two small boys, 5-year-old MJ and 2-year-old Mikey.
Basically, my cancer is fighting back. So when we do the chemotherapies, it shrinks it down quite a bit, but it doesn't get rid of it completely.
Let's get those cells in there, okay? Kill the rest of that cancer once and for all, by golly.
Dr. McGurk is great with the honesty. He just puts it right out on the table.
Dr. McGurk says CAR T-cell immunotherapy is Amy Jo's best hope.
The science is extremely sound. The preliminary results in children with acute lymphoblastic leukemia, 90% were going into complete remission. That was in the New England Journal of Medicine. And the New York Times made world news because it was such an extraordinary result. And so we're hoping for the same kind of results here. This is a young mother with 2 little kids at home who are counting on this being effective.
Well, the doctors keep saying 50 to 60 more years would be nice for me, but I'd honestly be happy with 20 more years. I'd like to watch my children grow up.
So Amy told us you're a straight shooter. What is her prognosis and how common is her cancer?
Her cancer is the most common type of non-Hodgkin's lymphoma in adults in the United States. Her prognosis is extremely poor. Her cancer's grown through prior chemotherapy and most recently a stem cell transplant. So without some novel form of therapy like this, her survival would only be expected to be several months.
How does CAR T therapy differ from chemotherapy?
So chemotherapy is administered to destroy the structures inside of cells, very specifically molecules make up chemotherapy. In this case, we take the T cells out and we engineer them to recognize the cancer cells, molecules on the cancer cells, and attach a machinery, a killing machinery, inside of that T cell so that it punches holes in the cancer cells to which it's attached.
The University of Kansas Cancer Center's Blood and Marrow Transplant Program is the first in the world to get patients for the novel CAR T-cell clinical trial now underway. Why was our program selected and how proud must you be?
We are one of the largest stem cell transplant, leukemia, and lymphoma programs in the nation. Not only are we one of the largest, but our outcomes are among the very best in the nation as well, and that's recognized nationally. And we're the first center, as you mentioned, to enroll patients on this trial in a multi-center national, but also international study.
Now, Amy Jo, she's just up the road from Atchison, Kansas, but where are you getting patients? You're getting referrals from all over.
We have a patient currently who's being treated from Australia. We have a couple of patients from Canada. We have a recent referral from Portugal, and others are coming in as well.
We had a chance to meet one of the patients who flew halfway around the world to be a part of this trial. Meet Carl Adams and his family.
Hemoglobin 6.8, so that's why that's the heart rate's going really high.
Yeah.
That's,
It's working hard.
Carl Adams doesn't like needles or blood. So when doctors in Australia told him the novel CAR-T trial in America was his best hope, he relied on his wife to help decide.
A background in environmental scientist, so I could get the gist of things. And I was really excited by the whole concept in the fact that it's not a chemotherapy, it's not a poison, it's your own cells working and your own immune system working against the cancer. And that's just, you know, the holy grail of cancer treatment.
They told 11-year-old Jade and 6-year-old Amber.
He has a form of cancer, I'm not sure which one. I'm not sure why either. I think it was just bad luck.
He had to go to Kansas City and bring the whole family to get his medicine, but they can't do it in Australia, sadly.
After his infusion of re-engineered cells, Carl has one more hurdle to be free of cancer. He needs a blood or bone marrow transplant.
My blood, my bone marrow is not a great match. So again, we're trying to find a donor, and so that's another part of the journey.
Someone around the world is a match for anyone that's waiting for a donor. So if anybody could get on the register, that would be a great help.
We'll get you healthy again.
Yeah.
It's just going to take some time.
Yeah.
As CAR-T therapy progresses, the need for donors will likely be even greater?
I expect so. CAR T-cell currently is not known with regard to its long-term outcome. So until we know those results and are we curing patients, we're seeing it as a bridge to a stem cell transplant using someone else as a donor.
What does this CAR-T immunotherapy mean for other cancers?
So far, leukemias and lymphomas have been the target, but other blood cancers such as multiple myeloma are being targeted. In addition, solid tumors such as breast cancer, colon cancer, lung cancer, they have unique molecules on their surface that could be a target for these CAR T cells as well, and such studies are already underway.
Thank you, Dr. McGurk. You can learn more about immunotherapy and how to be a blood and marrow donor at www.kumed.com/transplant/BMT. Thank you for watching.